Oh my
And
God.
nobody else did.
Nobody else has. That's all we've been working on.
So I will
I
be
thought you were kicking them when they were down, drawing blood. I thought that was a little much.
so I will be recording Brian from here. It
Oh,
gives
okay.
a wide screen, so just,
Yeah, that's fine.
yeah, so
Fine.
just for you to know if you have.
Yeah, no problem.
Right, can I just ask it from a context perspective? I was trying to decide whether to ask you this before you ran through or after, but I'm going to ask you before. So what would be the key things that you're trying to achieve in the presentation? Who are you targeting? What are the so then, you know, that context will help me then listen to what you're going to say and then feedback as to whether or not, you know, first time I've ever heard you say it.
So when we signed up for this District Ventures and we were told to be accepted, I really wasn't sure that we were looking for any smart investment. I kind of evolved my thinking about that we are. So definitely that's the purpose of this presentation.
Okay.
All right. So after waiting at Foothills Hospital in the hallway for 4 hours with my mother, who was 20 years, it was in her late 70s, having been in the ER for 4 hours, at 1 o'clock in the morning she asked for something to eat, and the nurse said to her, "You're not the only patient here, you know." What possible reason would it be for anybody to speak so disrespectfully? And I want to say in the 34 years now that I've been a speaker, and for the 25 years that I've focused strictly on healthcare, my personal mission is becoming transforming healthcare to be patient-driven. And my mother has always been my lab for that. And what I've learned working in Canada, where healthcare administrators are overwhelmed with volume and they're struggling just to keep up. In the United States, where the competition is so intense that every administrator is just doing everything they possibly can to not lose one patient, that they have two things in common. Number one is they all believe that providing a 5-star patient experience is the right thing to do. And number two, they want to provide a 5-star patient experience. It would be impossible to find anybody that is not obsessed with that, and we have become obsessed with that in our focus of our new platform called CareSay. We're thrilled that we have this relationship with IBM, and we're very excited to use not just artificial intelligence, but natural language processing. The IBM cloud, and particularly blockchain, which we see as a fabulous opportunity in terms of privacy. There are 3 ways we will be and are disrupting the marketplace. The first is educating the caregiver to deliver a 5-star patient experience, and we're doing that with a new app as part of this platform called Everyone's a Caregiver. And the cool thing about this is, let's understand, in healthcare on both sides of the border for the past 2 decades, there has been this dramatic demand for higher productivity. And as a result of that, there's less and less and less live hours for nurses and caregivers at every level to get out of bedside work and to be able to learn about how to get better. Secondly, it's empowering the consumer to have a real-time say in getting better care. You've just left the ER, as I talked about, at Foothills Hospital, and you're thrilled with the nurse, or you're really ticked off with the experience. What do? We've created this awesome app that is empowering the consumer now to have a say in getting better care in real time. And thirdly, in the last 12 months, I have personally been in 22 hospitals. I consider myself a world-class expert on the subject of patient experience. 21 of the 22 hospitals, I couldn't find anybody in senior management that understood how to use the patient satisfaction survey tool that they're paying outrageous costs for in a way that they could meaningfully use for continuous improvement. And so we're pretty excited about engaging administration with a cost-effective survey tool to give better care. We've been in this market for a long time, and it's interesting to see how the significance of it. Now understand, healthcare is 17% of gross domestic product, but let's really focus on where we are, and that is there are 7,000 hospitals in both Canada and the United States, home health agencies, almost 12,000, long-term care, nursing homes, assisted living, continuing care communities, independent living is 58,000 units, and there are 254,000 medical group practices, and that doesn't include dental, and that doesn't include optometrists. So we have 331 prospective clients. Now, all of our 3 tiers of our suite of our new platform, CareSave, are based on a recurrent revenue service model. And the way we designed this is that for a hospital and home health, the fee schedule is based on number of employees. So there's a big difference between a 25-bed hospital employs 300 employees or 800-bed hospital employs close to 10,000 employees. Emergency department, the number of visits, and that varies incredibly. For clinics, our fee schedule is based on the number of physicians, and that includes mid-level, so nurse practitioners and PAs. And for long-term care nursing homes, based on the number of beds. Now, understand, our market is very specific. The real decision makers in these organizations are 3 groups. Number 1, they are directors of quality, people whose job it is to improve performance improvement. Secondly, it's directors of nursing or chief nurse officers, because typically they're looked to for improvement, even though it's not just about nursing, it's about everybody. And thirdly, the real decision maker is the CEO, the administrator, or in the case of clinics, the managing partner. So those are our very specific target markets in terms of our business model. Now, the synergy of our business model is 6 things. First of all, a tool that empowers the patient to get real-time say. Secondly, the fact that we have created this survey tool that is going to completely disrupt the marketplace in terms of cost. Thirdly, the fact that we have the tool that educates caregivers. So all 3 of these have a direct correlation with each other. The fact that we've been in this business for 34 years successfully, we have intimate knowledge of how it works. We're not starting off from scratch. We have an awareness and market presence. Now, I do want to say that I have been out in the marketplace since we launched this, since we began designing this product. And every CEO that I've spoken to, particularly in the last 8 weeks, has responded to my description of the product with enthusiasm. They absolutely love the idea that they can get real-time feedback and that they can get a star rating with patients while they have a chance to influence their care before they're gone. And in 2017, Custom Learning, the founder, the spin-off of this company, we won the Export Development Corporation Award here in Alberta. And I want to tell you, one of the magic parts of this synergy of these 6 things is we know how to sell. We've designed sales training programs. We love to sell. We have a systematic model to do that. Well, let's talk about the opportunity, dynamic growth forecast. We're excited about this because we've had an enthusiastic client-based response. 80% of our revenues are based on the fact that these will be 3-year subscriptions, so we're not just selling and having to start again and again and again. Recurrent revenue model. Thirdly, we have a highly disciplined sales process. And fourthly, value-added resellers. So an important part of our sales strategy is not just our doing the selling, but selling through others. We have had a relationship now with the largest e-learning organization in North America called Relias. We've already licensed them for some of our products, and they're extremely interested in licensing 3 pieces for their distribution system. Now, and again, we're pretty excited about starting from our current base and what we've been able to do in the past year and where we see the market growing over the next 5 years. The best story, the best part of all of this is our team. If we look at our core team and everyone's learning, everyone's a caregiver learning systems, we have over 100 years of experience. Our medical expert faculty, first of all, Dr. Michael Klein, our Chief Medical Officer. He was an anesthesiologist, he was a pain doctor. More importantly, he was the Chief Medical Officer of an 800-bed hospital in Pennsylvania. Phyllis Van Cromberge, CEO and Chief Operating Officer, but Chief Nurse Officer for most of her career. Dr. Janet Craig is a family practice physician in Edmonton, and Jean Eaton is a family practice expert, administrative expert out of Edmonton. Our technical partners are second to none. We are thrilled with our partners our technology partners in Blue Ocean, and they're 8 team members who have a couple hundred years of expertise. We are, one of the great attractions, of course, was being able to partner with IBM, and we're delighted with Wael Badawi, who's brought just tremendous expertise as well. And we have a fabulous mentor in Andreas. So Andreas, thank you